Welcome to tonight's webinar. My name is Scott Klein, Programs Manager for Can Do Multiple Sclerosis. Thank you for acting on the belief that you are more than your MS by attending tonight's webinar, Invisible Symptoms by Allison Shaddy. I want to start tonight's presentation by talking a little bit about Can Do Multiple Sclerosis. Can Do MS is an innovative provider of lifestyle empowerment programs for people with MS and their support partners. We are the start of a whole new way of thinking about and living with MS. Can Do MS empowers people to move beyond their MS and giving them the knowledge, skills, tools, and confidence to adopt healthy lifestyle behaviors, actively co-manage their disease, and live their best lives. Can Do MS launched our new website last summer, www.mscando.org. Please visit the website where you can. Register for upcoming webinars, listen to archived webinars, check out our upcoming Can Do MS Lifestyle Empowerment programs, share your Can Do promise, and learn about ways you can contribute or get involved with Can Do MS. So we have a few housekeeping items before we get started tonight. First, Allison will address questions and comments at the end of the presentation, and we encourage questions and comments throughout the presentation. To ask a question, type your question in the chat feature located on the left side of your computer screen. To submit a question, type in the small box that says Chat with Presenters. This presentation is being recorded and will be archived on Can Do MS's website. You're more than welcome to view the presentation again, and if you missed one of our other webinars, you can find the archived version on the website. For those of you who are attending live tonight, you will receive an email tomorrow with copies of this PowerPoint presentation. As many of you discovered when you logged into the webinar, new in 2011, you can listen to the live webinar through your computer speakers rather than having to call in. So the job of the live participants tonight is to 1, submit your questions and comments in the chat box, 2, complete the evaluation at the end of the webinar, and 3, review the webinar schedule and register for the upcoming webinars. So we have a great speaker lined up for us tonight. Her name is Allison Shaddy. And Allison is a licensed clinical social worker. For the past 12 years, she's counseled hundreds of chronically ill clients and their families. Diagnosed with MS in 1994, Allison works passionately to serve and educate the MS community. She's the author of MS and Your Feelings, Handling the Ups and Downs of Multiple Sclerosis, published by Hunter House in 2007. She's a regular contributor to several publications including Inside MS, Momentum Magazine, MSAA, and MS Focus. Allison speaks nationally on behalf of the NMSS, MSAA, hospitals, and other healthcare organizations. She is a featured guest speaker for the MSAA's A Closer Look video series, as well as a guest speaker on Health Talk, Patient Power, Oregon Public Broadcasting, and other radio and teleconference programs. Allison has developed and conducted quarterly telephone education programs for the NMSS for the past 10 years. She's an active member of the National Association of Social Workers. So before we get started tonight, I'm going to let's do a quick survey to see who's on the call with us. So I just put up a survey. And please tell us about yourself. Are you a person living with MS? Are you a support partner? Are you a healthcare professional or other? And we'll give it just a moment here to see who is on the call. Okay, so it looks like about 98% of us are people living with MS, about 7.5%, 8% support partners, and almost 5% healthcare professionals, and 1.2% others. So with that all said, I'm going to hand it on over to Allison.
Thank you so much, Scott, and thank you everybody who's on the line. Really excited about this evening's program and thrilled to see how many people are joining us. So this is going to be hopefully an enriching next 45, 50 minutes for you all in terms of getting some information, maybe hearing some different ideas. We're going to be focusing on sort of a little bit of a unique topic today, which is dealing with the invisible symptoms of MS. And as Scott mentioned, I have a lot of background working with individuals who live with this disease in private practice and out in the MS community. And a theme that just sort of kept coming back to me in my work with folks is that sometimes these invisible symptoms are really the most challenging thing that we face in our day-to-day life with MS. And I think, part of the reason is that when things are invisible, people don't see what we're struggling with. You often hear this sort of comment that, but you look great or you look fine. And as a result, because we look okay, I think people continue to have the same expectations of us, and they just don't really quite understand what it is we're going through on a day-to-day basis. If we're on crutches or we're using an assistive device of some type, you might get a little bit more, empathy, compassion, understanding. But because so many of these symptoms that come along with MS are invisible, there's a lot of room for misunderstanding, miscommunication, and quite frankly, people can feel pretty isolated and alone and misunderstood with this disease. So, part of the message, I think, tonight is that you're not alone, that there are other people out there who do get it, and a lot of them are on the phone with us tonight, and that it's really important to find those ways to connect with others who do understand what you're going through. And the other half of that is to begin to take responsibility ourselves for communicating, what's going on with us. And we're going to talk a little bit about that. But before we kind of get into the specific solutions to some of these things, I just want to really kind of go through and validate what you might be experiencing now by addressing some of the most common invisible symptoms of MS. These are the things that a lot of people deal with on a day-to-day basis, and I sort of rank them on this slide here in terms of, which are the most common on down. And I start with fatigue and insomnia. Fatigue is really one of the most disabling of all the symptoms. And, that might surprise some people, but when we are fatigued, it impacts everything. It impacts our mood. It impacts our emotions. It impacts our ability to enjoy things on a day-to-day basis. It impacts how we relate to other people. When I am exhausted and not having the energy to do things, if I get a phone call from somebody, it feels more like an imposition than, somebody that I'm happy to hear from. It has nothing to do with what they're saying. It's about how I'm feeling and how exhausted I am. And so rather than being happy to hear from a friend, I feel like, it's one more thing I have to do. And shoot, they can't tell that by looking at us, can they? I mean, they don't know how tired we are. Very hard for people to understand this particular symptom. And so there are a number of different things that contribute to fatigue, but one of the ones you don't hear about very often is that insomnia is a very common problem with MS. And we're going to talk a little bit about some of the ways to deal with insomnia, but if we're not getting a full night's sleep, even if it's simply because we have to get up several times during the night to go to the bathroom, that's going to interrupt our sleep cycle, and that's going to contribute to our fatigue. There's a lot of things that are going on there. Cognitive difficulties can contribute, problems with depression, stress, any number of things can contribute to fatigue. And when I talk to people who have MS and I talk to their families, I find that this particular symptom is one that is very hard for the families to understand, and it's very hard for the person who has the disease to, communicate and to explain how fatigue is affecting them. The other issue that we come across quite a bit, and actually about 50% of people, 50 to 60, struggle with cognitive difficulties with MS. And that can range, anywhere between mild to pretty severe. It typically, though, manifests in a pretty mild form. But folks do have difficulty, depending on where there's disease activity in their brain, with processing information, sometimes with word finding. It can be maybe with problem solving. But again, cognitive issues are something that don't announce themselves necessarily. You can't necessarily see it. So if you're still in a job situation, people aren't necessarily going to know that you are having difficulty with cognitive issues. Therefore, they're going to expect the same amount of performance. They're going to expect you to be able to, juggle several things at one time or multitask, handle a lot of different stimulation. And so once again, in terms of dealing with the cognitive issues, that's going to be something that we're going to have to really take ownership of, responsibility for. You might want to get, if you are suspecting you're having issues here, might want to get some neuropsych eval testing to find out what areas you are struggling with. Because the good news is, there are things that can be done to help and to assist and to adapt and to work around cognitive difficulties. But they've got to be, given a name. They've got to be identified, and they've got to be addressed, and then it has to be communicated to others that we are struggling. Personally, once again, one of the things that I tell people is that I can't have a lot of background noise going on and listen to a conversation and take it all in at the same time. So I'm the one that has to speak up and say, hey, I need for y'all to turn down the music, or I need to meet you, in a more quiet setting so that I can have a meaningful conversation. So, that is another issue and another very common invisible symptom. So if you're struggling with that, once again, you are not alone. Third issue is depression and other emotional aspects. As Scott mentioned, I wrote a book that basically addresses all the different emotional aspects that come up when we live with a chronic illness like MS. And depression is a big one. And about 50% of people with MS will suffer from a clinical episode of depression at some point during their diagnosis. And there are a variety of reasons for this. Some folks might jump to the conclusion and say, well, sure, if you have MS, you're depressed. But that's not necessarily the case. What can happen, though, is that there can be areas of the brain, once again, that are affected by lesions and disease activity. And depending on where these things occur, it can have a dramatic effect on our mood and our affect. Depression is something that, unfortunately, there still is a stigma attached to, just, as are cognitive difficulties. And so a lot of times I think people don't really express, how down they're feeling. They have difficulty talking to others about it. Maybe they worry that other people won't understand. And as a result, depression can go, untreated and undiagnosed. And this is something that really makes me sad because of the many different symptoms that we deal with. Depression really is one of the most treatable of all the different symptoms, and through a combination of, therapy and sometimes antidepressant medications, people can be very successful in treating depression. And in my practice, I had a lot of people come in and they thought they were having, severe fatigue and severe cognitive issues related to MS. And lo and behold, when their depression lifted and depression was treated, those other problems improved. But again, depression is, one of those invisible symptoms that is difficult for others to see. And so we don't always get the compassion, the empathy, and the understanding because people don't know what's going on with us. The other thing I list here is, dealing with pain and spasticity and even sexual intimacy issues. Again, these are all things that you may not be able to see, but are there, and they're very real, and they need to be addressed. Unfortunately, a lot of people who have MS do deal with physical pain on a daily basis, but the good news is there are many ways to treat pain. There are ways to treat spasticity. There are ways to deal with sexual intimacy issues. However, they need to be discussed. We need to go to our neurologist, find a medical team that we feel comfortable talking to and sharing this information with. My philosophy is anything that we can do, any tools, any ammunition that we can take to this battle with us, we should arm ourselves with, because it's a tough enough fight. And there are resources out there. There are tools we can use. And if it includes some kind of medication or intervention, then we should take advantage of that. I'm a huge advocate of it. And with pain, there's many things. There's meditation. There's different type of breathing exercises, stretching exercises. It's not all about just popping a pill. But the important thing, and the message I'm trying to get across, is that we want to own these issues that we struggle with, claim them, say them out loud, and then put together action plans, not just sort of accept that, well, this is how it is, because it doesn't necessarily have to be that way. There are things out there that we can take advantage of. Bowel and bladder issue, again, highly stigmatized symptoms, something that people may not see but can have a huge impact on our lives. I don't know how many of you on the phone have had the opportunity to go to the Can Do programs, but I was very fortunate to attend one last year, the 4-day program, and they had a specialist come and speak about bowel and bladder issues, and it was a wonderful presentation. And that particular doc, I'm spacing on the name right now, but just had so many different interventions and ideas that nobody I had ever spoken with had mentioned before, in terms of just a generalist, neurologist. But again, a stigmatized issue is something that's very difficult to talk about and discuss, but is a reality. And finally, vision and balance problems. We would try to maybe compensate for balance, looking at, how holding on, there's something where you kind of hold on along the wall, or, maybe if you start to avoid different situations, in terms of like going to a mall or walking down a busy sidewalk. Balance problems themselves can just make, walking and movement more exhausting. Sometimes we don't even know that it's going on, but we're compensating, and our mind is having to work that much harder to keep us, upright. But again, other people may not see it or may not know what's going on. Unfortunately, a lot of times people think that, MS patients have been drinking or on drugs because of difficulty with balance problems and vertigo. So these issues are all there. They're real, and they each present unique challenges. But today, what we're going to do is we're going to first validate that these things are real, and then next we're going to talk about the way that we can basically address these on several different levels. But first, I'd like to just stop for a moment and ask the people who are out there, what is your most challenging invisible MS symptom? I'd love to get a chance to get a feel, for the audience and what you're experiencing. I'll give you all a minute to respond. It looks like the responses are coming in. Okay, I think we're just about there. So it looks like quite a few people have mentioned cognitive issues. Quite a few people. The winner is fatigue here, and then pain and spasticity are sort of in third. So definitely a mix, of the audience of what people are experiencing. But it looks like everybody's having a little bit of all of these things at some point. At least somebody on the line has had, something that we're talking about. So, if nothing else, again, this kind of validates your experience and validates that, yes, these are real symptoms and they are things that many, many people with this disease face. So talking about what do we do, how do we handle it, again, I think that for me, looking holistically at this and looking at the whole person, healing really does happen on 3 levels. We have our physical body, we have our spiritual self, and we have our emotional self. And I sometimes envision this as like 3 legs to a stool, and we need to address all 3 of these parts of ourselves to stay in balance and to be, the best self that we can be. And so we're going to take a look at, how do we sort of reinforce each one of these aspects of ourselves. Now the first thing is, how do we deal with the physical? How do we basically arm ourselves with what we need to be able to function at our most optimal level despite the problems that we are having? When I was first diagnosed in '94, they had not quite yet started bringing out the disease-modifying drugs, so there was nothing available. I was doing all kinds of things, bee sting therapy from, cranial sacrum to everything I could through diet and whatnot. But when the new medications started to come out, they were new back then, I did work to find the one that was right for me and take advantage of that. I was so grateful that something had come out. And I understand that, they're not for everybody. Everybody has their own personal beliefs. However, if your doc is telling you that the type of MS you have might respond to a disease-modifying drug, I would really strongly encourage you, to take a look at that and to weigh the advantages, weigh all aspects of it. But I know for me, my thought pattern was, well, I don't want to look down the road 10, 15 years from now and have to ask, what if I had tried it? Would I be in a better situation today? It's an important decision. It's a decision to talk to your care provider about, to your family about. But we do live in a day and age where, specifically for relapsing remitting MS, there are several options out there that neurologists are recommending today. So that would definitely be something to explore. I would also encourage you, as I mentioned earlier, to look at the medications that they have out there for things like spasticity, for things like depression, pain, bowel and bladder issues. A lot of times we're very hesitant to take yet another pill or another drug, and it's a fine balance, to find what's right for you. But I also think that when we can do ourselves and our families a disservice when we just sort of deprive ourselves of things because we just don't want to take a pill. I've really seen the quality of lives improve in many, many people with MS once they fully avail themselves of the things that are out there. In terms of the depression, again, treating that, taking a look at what's going on there. As I've said, there is nothing necessarily, like in terms of medication, that I'm aware of anyway yet for cognitive issues. However, if cognitive isn't, if cognitive is part of what you're dealing with, and depression is underlying, then you treat that depression, and oftentimes you will see that the cognitive can get better. So although there's not necessarily medication for that, or if you treat the fatigue, sometimes cognitive can get better. So these things are all kind of tied in together and sometimes influence each other. The other thing I'd really emphasize and suggest is to take a look at things like occupational therapy. Now, occupational therapy, for those of you who don't know, someone kind of takes a look at what you're doing on a day-to-day basis, and they can help you with things as simple as how to cook a meal. Maybe just putting a stool up by where you do the chopping, or different pieces of equipment that you can use in the kitchen that will save you energy, save you time. Very simple things, maybe how you're sitting at your desk, how you're at the computer, looking at, what kind of distractions are in the room that might be causing you to fatigue or get distracted. So I think occupational therapy is something that's underutilized. A lot of people don't really know what it can help with, and it's always worth talking to your doc about that. Same thing with physical therapy. You know, a lot of people hear that exercise is great, and it is, but if you're having physical limitations that are making it difficult, a lot of times the tendency is to just say, well, I can't do that anymore. And yet there's so many things out there that you may be able to do, such as yoga, such as swimming, all kinds of different, classes available. It might be different from what you used to do, but there's still a benefit. There's always a benefit in continuing to move. There are videos out that have specific for people with MS online that you can do everything sitting in a chair, but just to have the blood moving is really important, and it helps you psychologically as well as physically. So if you feel like you've sort of backed off of doing things exercise-wise, I would strongly urge you to talk to your doc about maybe getting a referral for PT. And speech therapy is another one. If you're having difficulty with speech and swallowing, things like that, ask your doc. There's vocational rehab counseling. There's cognitive therapy. If you're having trouble at work, it might be worth getting an evaluation, talking to a voc rehab counselor about other types of jobs that you might be able to do, to retrain for, to stay active, to stay vital, because there are changes that occur, and there's no doubt about that. However, part of our role as being our own best advocates is to look at, well, how do we best adapt to these changes, and what can we continue to do for ourselves to support ourselves and to, enhance the quality of our lives. And I know it's hard to stay motivated to do that, but I do find that the people who, try to stay engaged and who do look for answers and solutions and ways to, minimize the impact that their symptoms have on their lives, those are the people that tend to enjoy life the most and get the most out of the life that they have been given. So I'd encourage you to do that. And then there are complementary therapies, and that, there's a wide range of those. I mean, I think I mentioned when I was first diagnosed, I tried bee-sting therapy, I tried cranial sacrum, I tried Tai Chi, I've done Qigong, I've done hypnotherapy, you name it. And my philosophy is try everything that interests you, that you've heard can help, and then, leave behind what doesn't work for you. There are many, many things that are out there. There are many things that are suggested. I just think it's very empowering for someone with MS to be the one that's going out there and exploring these things and trying these things. As long as they're safe and you're not hurting yourself and you're not hurting somebody else, because this is a varied disease and different things work for different people. And there are a lot of things out there to explore. I think the bottom line is that you don't want to accept less than you deserve. You are worth it. You're worth the time. You're worth the effort. And it's important. It's important to explore these things and to look at, every way possible to take care of yourself and to be good to yourself with this disease. So part of what I'm talking about is controlling, what you can. I think that one of the really frustrating things of living with a chronic illness like MS, especially something that's so unpredictable as this disease, is that, we can feel out of control. We can feel like things are happening to us and that we're not really in charge anymore of our health and our bodies. Sometimes, a lot of the interventions and things that I've suggested so far have to do with kind of turning things over to the healthcare professionals. But there really are a lot of things that we can actually do for ourselves. And I've mentioned exercise, in terms of getting help through PT just to get a plan together. But trying to find a way to build in exercise to your daily routine is so important. It's important for everybody, but for people with MS, I think even more so, because we need to gather energy. We need to find ways to stay in balance. We need to find ways to cope. We need to manage stress. We have a lot more stresses than other people typically do in our lives. And so having an exercise program really helps with that. And then looking at diet. There are many, many different, things that are promoted out there in terms of diets for MS, and I'm not advocating any one diet because, again, I think it's different for everybody, and different people respond. But what I am suggesting is, since you're the one with the disease and it's your body, to take a look at what diet is doing. What foods seem to nourish you? What foods seem to energize you? What foods help you to think more clearly, and really monitor that. One thing I've heard consistently, and again, I'm sure it's different for everyone, but trying to have protein throughout the day, at 3 different meals a day, a lot of people say that helps with their thinking, that it helps with energy and kind of, gives them a more stable energy throughout the day. Having more little meals instead of holding off for just 1, 2 big meals a day. Different people have tried, the very, very low-fat diets, and some people say that that's great. Some people try raw foods. I do believe that what we put in our body really impacts us. It impacts us emotionally, it impacts us physically, and that it's up to us to look at what do our bodies respond to, and is that big sugar rush at the end of the day really serving us? Is it interrupting our sleep later on at night? Is it making us peak but then crash? Really paying attention to that. And I've mentioned this a couple of times, but stress management, I think, is another, biggie. And stress in itself, that could be a whole hour, teleconference as well. But many people I work with come to me, and stress is something that they're really struggling with. They're struggling with all the changes. They're struggling with their relationships. They're struggling with their different abilities changing, and it's hard. So I think to just make it a priority that you identify, number 1, that you do need to manage stress, and number 2, finding that thing that works for you. A lot of people try meditation and find that works really well. Other people, just, being outdoors, different type of breathing exercises. Again, the yoga is a great way to relax. There are a variety of books and techniques, to be able to sort of take on what meets your needs and in the time frame that you have. But I mean, even just a really simple one, I suggest every time somebody gets in the car and puts their seatbelt on, just pause right then and just take in, 4 or 5 deep breaths. It's something that you're doing oftentimes several times during the day, and just to slow yourself down, get your heartbeat settled, get yourself centered. It doesn't have to be, a big, long, involved thing to do to kind of manage your stress and just sort of check in with yourself. So that can be very helpful. The point being, it is important to manage stress. There are, a lot of people that feel that stress aggravates their symptoms. There are a lot of people who feel that, when they're managing their stress, everything else feels better in their lives. So you need to ask yourself if, how is stress impacting you, and, how much are you willing to commit to managing that piece of your life. So that's stress management. The other thing I'd really encourage you to do is try to monitor your fatigue and to pace yourself. For many of us, we find that, the mornings are better times. We're not as tired. And so, I would suggest that that's when you do maybe your more mentally challenging work, or have your more important discussions, whether it's with family or friends. Do the more challenging work. For other people, it's later in the evening. And if that's true, great. The point is, know yourself and know what you need to do. When I was first diagnosed, I was working in home health, and I'd be out in my car working through the day, and what I found was, taking a little blanket and a pillow and just taking naps in my car at lunch. I'd eat something and then just lay down, just even if it's closing your eyes for 20 minutes and just giving yourself permission, to check everything else out and just relax, even if you don't fall asleep. Other people say, well, if I take a nap, I'm more tired. And that's okay. Just know yourself, know what you need. But just closing your eyes and not picking up a phone, not checking email, and just letting yourself breathe can really help you to get a second wind so that you can pace yourself throughout the rest of the day. So this is an important thing to kind of look at and look, what makes you tired, what particular things make you tired. Sometimes like being around other people is energizing for some folks and exhausting for other people. So, know yourself and then try to schedule out your day and commit to the things that, are either going to energize you or tax you according to what you think you're going to be feeling up to. And I know it's hard to do that. It's hard to know, but if you can pay attention to what your rhythm is and how your days typically unfold, for instance, if you know that you're going to have a really busy day the day before, then you're going to have to clear your schedule for the following day and not commit to anything. That way it doesn't catch up to you. You build these breaks in and you pace yourself and really pay attention to that. So those are some of the things that we can actually do for ourselves. Regarding communication, one of the things I hear a lot of people say who have this disease is, I want my family, I want them to know, what I'm feeling. I want them to know how tired I am, or they should know by now that, I'm not up to cooking dinner at night. And, I find that when people just expect their loved ones to know what they're thinking or what they're feeling, they often end up being disappointed. And it can be hard, to have to be the one taking responsibility for saying, how tired we are or what we're feeling. But it does help in terms of them knowing, your loved ones or coworkers or what have you, knowing how to respond and how to assist you. Otherwise, they're kind of in the dark and they're making a lot of mistakes. The other thing, unfortunately, that I have found is that people will pretty much assume that you can do everything you were always able to do unless you tell them differently. Because you know what? It's a pain for them if they have to pick up the slack or they have to say more or do more. They don't necessarily want to do that. And so it's going to be up to you to say, hey, I need this. I think another, trap or difficulty that we sometimes fall into is just sort of faking, how well we feel or trying to push through our day or deny, really how we're feeling. And that does us a disservice, and it also can add to the confusion of, the people around us, because if we're pushing it and we're faking it, they're going to think that we can do a lot more and handle a lot more than maybe we really can. I also find that's often how we get hurt or, fall or, get into arguments because we're stressed or we're tired or we're frustrated and we're not ourselves. So you're not really doing yourself or anyone else favors when you push through it and fake it. I've had folks tell me that, they don't really like to have to be the one that's always saying, well, I don't feel well or I'm not doing good. And I get that. You don't want to be seen as maybe complaining. And so there are different, ways that you can strategize around that. I had one client come up with sort of a rating system that she would put on her fridge, and depending on what kind of day she was having, she would put like a rating of 1 to 5. And so if she was feeling great, it would be a 5. If she was feeling rotten, it would be a 1. And her family could come in and take a look at that without her necessarily having to verbalize how she was doing. And then they could kind of gauge, how much they were going to help or what they were going to do, or they'd give her time for a nap based on that. For my husband and I have a little signal with my finger when I'm ready to leave a party or, I'm getting too tired. I just sort of do my little finger motion, and he knows without having to speak up in a group full of people or, make a big deal out of it. So I think there are ways that you can find, to kind of help yourself communicate without, maybe feeling like it's a big deal. And the other thing I would just suggest is do have a few people that you can talk to who are friends or family, and even go as far as to have a little, cheat sheet by your phone of a couple of numbers of people that no matter how bad you're feeling or what kind of day you're having, you can pick up that phone and they're going to listen and they're going to be there for you. And don't wait until things have gotten so bad before you pick up that phone. Stay connected and talk to people who are good listeners and are good friends. Not the judgmental, critical ones, because they just bring us down, but those that are good listeners. So that's the communication piece. I think it's really helpful to look at this whole thing about being positive, and what does that mean, and what does that mean for you? I tell my clients to practice forgiveness, and when I talk about that, I mean practice forgiveness of others, because they're always going to fall short. Practice forgiveness of yourself, maybe of your body. I've had clients who are very angry at even God because they don't understand why this has happened to them. And I just think that, practicing forgiveness, being gentle with yourself, being gentle and kind with others, it comes back to you in a gentle and loving way, and it serves you more, in the long run. And taking a look at all the things that you do have to be grateful for. Thanksgiving's coming up, and there typically are a number of things that are going well, that are working for us. Even if it's as simple as the cat at the end of your bed in the morning, or the sun coming up again, or a good hot meal at the end of the day. There are always things that we can look at to say, that we're grateful for. And then to surround ourselves with positive influences. If you find there's a lot of negative stuff on the TV and it gets you angry and it brings you down, turn it off. Listen to music. Do something that's uplifting. And finding ways, too, to stay active and to stay involved. I, used to work with the peer counseling program with the Greater Washington chapter of the MS Society, and I had many volunteers involved in that program who served as peer counselors, and they would talk to people on the phone who were newly diagnosed with MS. And many of those people were homebound because of physical disabilities, and yet they found a way to give of themselves. And I guarantee you it was enriching their lives as much as the people that they were supposedly helping. It's really, important, I think, to find those ways to get out of yourself and to give back to your community. And really, no matter how, affected we are by this disease, we can often, if we look, find a way to still give back and to still contribute. This next piece I just want to talk about is developing a spiritual practice in our lives, and this is sort of that third part of the stool, and you don't hear about this that often, but I think it's really, really important. And I am not, in any way trying to define what spirituality means for you, but I think you need to define what it means for yourself, and that each of us, can find something that is greater and bigger than us to look toward and to draw strength from. It's different for everybody. It can be religion. It can be nature or being outside. It can be through prayer or meditation or song or, like I was saying earlier, service to others. It really doesn't matter. What does matter is that you practice it on a regular basis, that this becomes a key component of who you are. And I do find that the people that have a strong spiritual practice, they tend to be the people who have this centering place to come back to when everything else feels out of control. It gives them a way to be grounded and to be centered, and it gives them a place to gather strength and go back out and do it again. So if that's an area of your life that has been neglected, I'd urge you to take a look at that. The next thing I want to talk about is just defining, your motivator. It's like, what is it that makes you, want to get up every day and to fight for your health? What is it that makes you want to stay well? I call it finding your bliss. So, again, just like the spiritual practice, it's different for everybody. It's a very personal choice. For some it might be their child or grandchild. For others it's a pet or a job or a spouse or a lover, a great friend, some kind of creative outlet. Whatever it is, I really want to just encourage you right now to write down what it is that, brings you bliss, that makes you want to stay well, that really makes your life worth living. And have that up on your refrigerator. Tape it up if it's a picture, if it's just some kind of reminder of what it is that motivates you. And you know, I'm doing a little questionnaire right here. If people want to, you know, sort of weigh in here and let us know, for you, what is it? Family, friends, creativity, work, volunteering? And the responses are coming in, so we'll give just a minute for that. Okay, I'm going to go ahead and move on. And it looks to me like, you know, family was certainly a big, big motivator for people, but quite a variety of things here. But about close to 70% feel that that is a real, you know, thing that keeps them wanting to stay well and get better. And that's great. It's really important that you know that. Oh, the pets are moving up, and that's probably a good time to share my Bliss. And this is my little Ellie girl when she was a puppy, and she is now, we weigh the exact same amount. We're both 127 pounds, so that's what she turned into, if you can believe it. But yeah, I think it's really important that we know what that is, what it is that makes us want to embrace the day and get up and get going. And then just believing that we're worth it. You know, I think this disease can sort of beat us up self-esteem-wise, and I think that it really is ultimately up to us, you know, in terms of how we see ourselves and how we value ourselves and what we valued and how we saw ourselves prior to this disease and after having this disease may change a great deal. And sometimes we need to, you know, take a look at that and really sort of reevaluate things. And then to also focus on what we are able to do day to day and not so much dwelling on what we can't, not comparing ourselves to the way we used to be, because, again, it doesn't serve us. That kind of thinking, it holds us down. So, you know, really understanding that you're worth these efforts, that there's value in taking the steps to, you know, do what you need to do to take care of yourself. And finally, just to wrap up by saying, you know, it is important to stay connected. It is important to talk to others who get it, who understand. Take advantage of all these programs that are out there. Scott mentioned several. There's also, you know, stuff on the Internet. There are several good websites. The National MS Society has a lot of good programs. You know, find that thing that feels good to you, that way to connect. And you know, take advantage of it. Sometimes, you know, support groups aren't for you, but sometimes maybe if they aren't for you, sometimes just going to meet a couple of people and then, you know, continuing to sort of stay connected to individuals can be very, very helpful. So just to wrap up, you want to find your bliss. You want to share your talents with others. I think, too, just knowing that we are much more than our bodies. You know, we're not just the skin and the muscle and bones. We're our heart and we're our soul, and that those things matter as much, if not more, than our bodies. And that, you know, we need to let the heart and the soul and our spirit define who we are and who we will become, rather than, you know, the limitations of our physical selves. And with that, I'm going to wrap up. I guess I should say, you know, also if any of this sounded helpful and it's something you want to explore further, I do have a book out called MS in Your Feelings, and it's in libraries. It's on Amazon. There are copies available through the Lending Library, through the National MS Society, but perhaps there will be more information in there that could, you know, give you some suggestions and tips that could be helpful. So I'm going to stop here, and thank you so much for your time and attention, and I think there's some time for some questions. Scott?
Yeah, thanks so much, Allison. Obviously, this is a very hot topic. We have a ton of questions, so I will do my best to answer all of them, and if we don't, I apologize. But you know, Allison, there's a number of questions about jobs and employers and that sort of thing. So I'm going to try to generalize some of these questions here. But so do you have any recommendations or suggestions on how to approach an employer with the invisible symptoms so that it can be variable and only sometimes affecting the job. Does that make sense?
Yeah, and this is such a tricky subject. I'm just going to say right now, because there are legalities to this, and employers are so different in how they respond. People have very different feelings about even revealing, that they have this disease in the workplace. I have to be honest. I have talked to many people who have shared this information and found themselves, without a job. And so you really need to know your employer, and I think it's a very individualized situation, and there are legalities. I don't know, Scott, if you guys have somebody on staff who helps with this. I do know that the National MS Society has people who are, workplace experts. They know the legal, ways to approach these in terms of they know the laws, and I really am not versed in that. But if you were to assume that, let's take that piece out. Let's just assume that you have shared with your employer and they know that you have it. And I don't mean to I don't mean to cop out on that, but I just don't feel comfortable because of the sensitive nature of different stories I've heard of how that turns out for people. I don't want to say go on out and do it, but if your employer knows already and they want to accommodate you, I think to say I want to do the best job that I can, and there are a few things that I've identified that I have found that make my job easier, and I want to know if you'd be willing to accommodate me with these things, and here's what I need. Or I have found that when I'm don't have noise or don't have the radio on in the background, or can have my own office, or easier access to work on a certain floor, really figure out what it is that's tiring for you. Or I need a 30-minute break to be able to go lay down. Just kind of say, I want to do my best, and here are some things that I've figured out that will help me to do that. Can you work with me on it? I think is a good approach.
I agree, and I would recommend that people do visit the National MS Society. The Information and Resources Center has, I believe, a plethora of information about accommodations and job-related information. So, yeah, okay, well, thank you. Another good question, what are some ways to deal with mood swings?
I think a couple of the things that we talked about, one is to look at, okay, when are we having those mood swings? What are some triggers? I definitely find that when people are more fatigued, they tend to be crankier and more irritable. And so if you can, kind of look at when are those mood swings occurring, what are the triggers? Is it difficulty in relationships with people? Is it difficulty or frustration over a work environment? Does it have to do, is there a lot of stimulation going on? I've talked to people who say my worst time is dinner time when everybody comes home and the TV's on and the dog's barking and, I've got the family talking to me and then I snap. So those are some of the things to kind of look at, well, what am I really needing right now that would help me to calm down, help me to have more patience? Again, simple things like, there's this saying, HALT, never get too hungry, angry, lonely, or tired. If you can just put that up on the refrigerator and ask yourself if you're having mood swings or any of these things going on that can be addressed and taken care of. And if it's really becoming a problem and you're really aren't yourself, or you're on a big, emotional roller coaster, it might be time to talk to a counselor or somebody that's a professional, where you can get into a little bit more depth about what's going on and what's the underlying cause of your mood swings.
Sure. Great. Okay, and another kind of hot topic in the question area right here is how do you deal with folks that dismiss your cognitive symptoms?
Yeah, it is difficult. One of the things I hear people say is, oh, we're all getting old. We're all, I forget things too. And I think that to maybe get really specific with people, like to say, well, I know we all forget things, but you know, I put the phone in the microwave today. You know, when's the last time you've done that? Or, you know, sort of give them a concrete example of how it really impacts you, and you know, depending, I mean, it's relationship to relationship, right? But if it's a relationship that's ongoing and you value it and you really need this person to understand, then it's worth investing the time and sort of, you know, pushing back a little bit and saying, no, you don't understand. I used to be able to, you know, cook dinner and talk on the phone at the same time, but now I can't. Now I really, you know, can only do this one thing, and I can't have you talking to me while I'm doing it, or whatever the specific, you know, situation is. But you know, kindly and gently sort of, you know, challenge and stand up for yourself and say, here's what it feels like for me, and be real specific.
Terrific. All right, and a few questions came in about acupuncture. Is there evidence that acupuncture is helpful?
You know, that's a good word, evidence. I don't know about the evidence of acupuncture. I can say that I have personally tried it for MS, and it did not help my MS symptoms. I've tried it for other things, and it has helped. I have tried it for plantar fasciitis, and it was effective. I don't feel qualified to say. I don't know all the studies. I don't know if there is, you know, an actual research study that's out there. I haven't seen one, but again, I think it's worth trying things and seeing what you find is helpful. But I don't know specifics on that. But and I'm not against acupuncture. I'm just saying, you know, for me personally, it did not help with my MS symptoms, and I did try it for that.
Great. And let's see, maybe just one or two more questions here.
Scott, can I just add one thing to that, though?
Oh, sure.
There are studies about yoga, though, and I sort of briefly saw some questions about yoga come up on the screen. And there are studies through Oregon Health Sciences University that talk about the benefits of yoga. So I do want to throw that out and say, you know, scientifically, there are, you know, definitely pieces of information out there that support that specifically for MS. So.
Terrific. And this is a great general question. How do you find someone professional to talk about MS?
I don't know what kind of programs you guys have, Scott, but I do know through the National MS Society has its own chapters, you know, either by region or even by state. And then they usually have a list of counselors who have been approved, you know, gone through specific training on MS that they recommend. And I also just want to say that a lot of times they have grant monies available that will cover like the first 6 appointments with a counselor.
That's great.
It's also really good to go through your neurologist. Usually a neurologist has a handful of mental health professionals that they work with, that they refer patients to, that they, you know, have a working relationship with and trust. So that's and then, you know, talking to friends also, or other people with MS who have had luck. But I do want to say, I think the particularities to MS are so important that it is really beneficial to find somebody who has a working knowledge of this particular disease and how it impacts people.
Terrific. Well, thank you so much, Allison. What a great presentation. And a big thanks to all the participants who joined us for this webinar. We had a great turnout, and we're excited about the upcoming webinars. That being said, the next webinar is on December 13th at the same time, 8 p.m. Eastern Time. The topic is MS in the Family, and the presenter is Dr. Peggy Crawford, Can-Do MS Programs Consultant. You can register for this and other webinars at www.mscando.org. For those participating live tonight, as soon as the presentation is over, you'll see a survey appear on your computer screen. Please take a moment to complete the survey and help us continue to improve our webinars. We value your feedback and input. Thanks, and have a great night, everybody.
Thank you, everybody. Good night.